In the Know, a radio program talking to the newsmakers in Ogle, Lee, DeKalb counties and beyond, keeping you in the know. Here's your host, Charles Van Horn.
Good morning and happy Sunday. I'm Charles, and joining us in studio from 4C, Kim Lamz, the Child Care Resource and Reference Director? Referral Director. My shorthand notes don't make sense. And then Kendra Nenia, the Higher Education and Workforce Development Navigator. I have no idea what those titles mean. We'll get into that shortly. First, let's talk about what 4C. Kim, what do the C's stand for?
4C is 4C Community Coordinated Childcare. So we are a social service agency, been around for about 50 years. And we do all kinds of supports for families, children, child care providers across a 6-county area. So that includes McHenry, DeKalb, Lee, Ogle, Carroll, and Whiteside counties. We offer services for families that include help finding child care, help paying for child care, home visiting, which our home visiting program has an office right here in Rochelle. That is still open and people can come visit us, but really we offer a variety of support services for those groups of people.
And when we talk about families and child care, Kendra, the economic impact of child care is devastating on families that, it costs a lot of money to watch your child while you go work, and sometimes those numbers get upside down.
Yeah, absolutely.
And you're paying somebody more than you're actually making to take care of your child.
Yeah.
So, Kendra, 4C works with child care providers, right? You guys don't actually handle child care, correct?
Correct, yeah. So we have the R&R is the resource and the referral. So we have actually where families can reach out to us and we can connect them with providers that fit their needs, their time, their money, whatever.
Location.
The location, yes, that's really important.
Yeah.
But we also have subsidy programs like CCAP that families can apply for that can help offset that cost of child care.
And that's where I think you guys are incredibly important is the benefits families can get. Now, I assume there may be some income requirements or things like that to be eligible. Yes. What sort of range are we talking here for, like, say, a family with 2 children? Is there like a ballpark?
The state sets those rates, obviously. It's a state program that provides state funding, and it's kind of a sliding scale. It's based on the size of your family, how many kids you have in care, your income, and your qualifying activity, which could be parents are going to school, parents are working full time. So there's kind of a calculator that the state put together that you can put all that information in, and it will kind of spit back out to you a general idea of whether or not you would qualify and what the state would require your copay to be, because they're your children. You take some responsibility in that, right? So the state's not going to pay your whole child care bill, but it's going to pay a good chunk of it and then help you to build that into your budget by lowering your portion of the cost. So it really depends on kind of all of those factors where you land in that.
The important part of this is that to get people into the workforce to keep a job or to get further education so they can advance in
Correct.
A job. And I guess the big social picture is we need these people to pay taxes.
Right.
So let's do a little bit now to get them a great footing.
Yes.
How many clients, I know you cover a 6-county area and it's a state program, about how many clients do you have a year, families that you're helping arrange just childcare for? I mean, I know I'm asking for a huge number. That
it will be a few thousand.
Yeah.
For instance, we have in our 6 counties, we have over 400 different child care providers that we work with. So you have to think that each of those could have anywhere from 3 kids in their care to 300 kids in their care.
Wow.
So it's a really wide range, but it will be a couple thousand.
Kendra, how long does the process take if you were to start it today and you are working full-time and you're like, this childcare thing, the ends aren't being met here, I need help? How long from getting the application in and starting at day one would you then get subsidies or support and a referral and be able to drop the kid off at the door with a backpack and get to work?
Right. I think it goes pretty quickly. I mean,
it does. It's within a couple of weeks as long as you have all your paperwork together. It's a state program, so state programs require a lot of paperwork.
Yeah.
So as long as you get that all together and it's really just a couple of weeks.
And we try to make it as easy as possible for families, because that's a burden, when you are required to fill out all this paperwork, and if you have to physically drop it off, if you have to mail it in, all that takes time.
And one of the challenges, I'm sure, is hours of operation for childcare, because people work all the time.
Yep.
Childcare places aren't open all the time, and that leads to some. Obviously, you're going to have family support and things like that to help make this process work.
Yeah.
And even if you have, like, say, grandparents or an extended family living in the home, you guys don't say, well, you have grandpa at home, you don't need 4C. You guys still go through the process and be like, no, you still should use this program to get some help.
Yeah, if you're needing help for childcare to cover that cost, because it is expensive. I mean, it's equitable to or equal to sending your child to college.
Yeah,
that expense is tremendous, and so I urge families, if they're feeling that burden, to at least check it out and try.
It's not going to hurt to fill out an application,
right?
Even if you don't make it, at least fill it out. And those guidelines are updated yearly. So maybe you filled it out this month and you missed the cutoff, but July 1, maybe those income guidelines increase and you may qualify then. So we always encourage people that if you're close to that cutoff and you miss it, apply again in a few months, because you could be on it then.
Yeah.
This is incredibly important info for families, working families.
Yeah.
That are struggling.
To that after hours care. So families oftentimes think, okay, daycare is open 7 to 5. Well, I work 6 to midnight.
Yeah.
There are places that do offer after hours care, so it's not impossible. It's not like there's no one there to help you. It spans the spectrum of what families need.
And you guys know that because you work with all the providers.
Correct.
So shifting from child care, let's talk about the child screening and development and things like that. What are some of the things that you guys do for early childhood?
So our family enrichment program, which, like I said earlier, has an office out here in Rochelle, also in our DeKalb office, there are staff. So our family enrichment program, they do home visiting, which is a program that they work with families with children birth to age 3. They will kind of intake this family, and the family has kind of a dedicated person that works with them, and they will come out, talk to mom and dad or whoever the caregiver is about development of the child, working with the child. It's really helping families to know what to look for and to help their child grow and succeed. So that program is available, again, free. All of our services are free to families. So they just have to kind of contact us, and they do an intake. They'll do a screening with them. Families may get referred to us through other programs that know, obviously, that we have this screening program. There are programs across all 6 of our counties that do home visiting and prevention initiative. But we have a good one. So.
And when you talk about home visiting, what are the types of activities or things that the person from 4C is doing with that family and with that child?
So they're going to come out, and typically they'll bring like a bucket of materials and work on specific skills with the child. They might read books with them. They might build blocks with them, and they really kind of talk to mom and dad about what is developmentally appropriate, how to help them learn and grow, like what they get out of playing with blocks or playing imaginary play or just out of reading books and what that does for their development. So they will kind of bring those tools out with them. They'll share stuff with families. They'll have family groups where they'll bring in a bunch of the families that they're working with, and they may have a speaker. They will do dinner. They'll play some games. They'll really kind of help these families build their community, I guess, so that they can learn and grow together.
And what happens if there is a need developmentally? What if they can tell the child is delayed in some attribute? You
They'll
guys can
refer
help.
out,
You guys
yeah.
can help identify that and refer that, right?
Yeah, we'll refer out.
Yeah, and the state of Illinois has some beautiful programs such as early interventions where, I can use my own child as an example. He needed early interventions because he stopped talking at a very young age. And so I was able to connect with them. But you can also do that through, like, if you're using FEP, which is the Family Enrichment Program, and there is a delay identified, they can really easily help you through that process. And it's a really fabulous network and connection.
4C have been around for a long time. And, you can go to public events. You can talk about it on radio programs like this. But how many people do you guys encounter? It's probably got to be at least on a weekly basis where I didn't even know you guys existed.
Oh, yeah.
I didn't know about any of this. What is like encapsulated for me? Sell a family on this of just come talk to us, we can help.
So that's really what we spend a lot of our time doing. Is trying to sell that, because unless you have young children or unless you work in childcare, you really don't know that services like this exist because you've never needed them. So really what we try to do is tell people that we're here for families and we're here for children and we're here for childcare providers and we're here to support anything that they need. So we really just push that out and say, you might not need us now, but you might find someone that needs us later. So remember us. Remember that we're here. Everything we do for families, children, and providers, we offer free to them. We are happy to help. We'll take walk-in clients. We'll take phone calls. We'll take emails. We'll video chat with you if you want to. But basically, if it comes to needing help for your children or needing help for your childcare, just reach out. Like we are here. We are happy to help and support, or to refer, or to point you in the right direction for basically anything that goes along with children with childcare.
And the providers. And I think that's a piece too. Is childcare providers can reach out to us, like to someone like myself, where I can help them to advance their training and education and to look for scholarships and to connect them with colleges and higher ed institutions. So there's a lot of facets to what we do. And so it's not just like mom or dad. It's like any caregiver of a child, any family of a child can reach out to us.
And the state of Illinois funds this program well? Are you guys having to write grants and scrape things together? Or is it you're always waiting for the next budget, to come out and get nervous, or are things pretty solid?
For us, things have been pretty solid. We are lucky to live in a state where our governor really supports early childhood education care. So we work off state contracts, which are always funded. We never have an issue with that funding. But within our work, then we will identify things where perhaps our state contract says we should be doing this, but we feel like, yes, we should be doing that, but maybe there's something else we can add on to that. So we will routinely reach out and try to grant fund additional services and programs that we can pull in just because we see a need that's not necessarily covered by our contract. So we'll try to find additional funding and build on that because we want to meet all the needs that we can. Right. And we're in a very unique position where we see so many of those families, we see so many of those childcare providers that we have a good idea of what that need is.
And being in a rural area, the number of childcare providers is significantly lower, and probably the number of openings is significantly lower too.
Absolutely. So we have a few areas in our service area that are really what are considered childcare deserts.
Yeah.
So we do a lot of recruitment and retention, trying to help people become childcare providers, and we do a lot of community events, just really talking about the importance of childcare, the importance of early care and development in young children. So we have staff that will go out and really help people kind of walk through the process of what would it be like if I wanted to open a childcare in my home, if I just want to watch a few kids, or what's the need in my area. So we can kind of provide some of that data and then help you through those steps of getting started.
Right.
If you are a parent or soon-to-be parent and you're going, oh boy, childcare is going to be a thing, or maybe I need somebody to come check out what's going on with Timmy, any of that stuff, how do they get a hold of you guys? Is there a website? Is there a phone number?
There is. So our website is four-c.org. It's nice and short. They can reach out to us at either our DeKalb office or our McHenry office, which are staffed full-time. Our main number is 815-758-8149, and they can get all of our services that way. Just call the main number and let us know what you're looking for, and we'll get you to the right person.
Thank you so much, Kim, Kendra, 4C. If you are a parent or a grandparent or a caregiver, or you have a daycare or a child care service, you two are the folks to talk to. Thank you so much for coming in today.
All right. Thank you.
Thanks.
Thank you for listening to this week's In the Know. The program returns next week at this time with another great conversation with someone from your community.